Merħba għal-episodju numru 6 ta' The Digital Health Voice. All right. Oh, it will be an international conference. Oh, an international conference on digital health and MedTech in Malta. Wow, more than 30 countries? All right, I better say that in English. Thanks for that. So, welcome to episode number 6 of the Digital Health Voice. Today, we will be speaking to Dr. Michel Bielecki, who is the CEO and co-founder of both Testasy and GobiX. And without further ado, I would like to welcome Dr. Michel. Hi, so welcome Dr. Michel to the Digital Health Voice. And it's a true pleasure to meet someone who I can speak Polish with. As I need to practice my Polish even in Malta, so to say. But I want to start a bit to talk about digital health. So I've heard that you are the co-founder of GobiX and Testasy. I've heard as well that you're involved also in distributed ledger technologies, such as blockchain. And that's even something extremely interesting. And best of all, I even saw that you have even some time for research. For me, that's amazing. That you're managing a company and you're doing research. So tell me, what's your digital health journey? What brought you here with us today?
Stefan, thank you very much for having me. And it's my really great pleasure and honor to be here. And I'm very much looking forward to speaking in Polish in person as well. My digital health journey, that's, where should I start? I think I was interested a lot in entrepreneurship, mostly actually, and digital health when I was a student. And I think I'm extremely lazy when it comes to repetitive tasks, when it comes to things that I think can be somehow optimized. And there's lots of them within the medical space, as you probably know as well. And I think everything started when I was a second year medical student, and my dad asked me whether I could help him writing medical reports because I was a fast typer. And I'm like, okay.
Oh, so your dad's a doctor as well?
Yes, I'm a third generation.
Okay, right, okay.
And so I asked him, okay, so how does it work? He's like, I essentially, I record a voice, then I send it over to you, then you type it, you send it back, then I correct it, we put it into a form. I'm like, wait a second, so how long does one report take you? And I think it was something like 30, 40 minutes. And if you count that up, right, you count it up to 10, 12 patients a day times 5, and you have dozens of hours lost every single month just on writing reports. And that's just for one single doctor. I'm like, this is incredibly inefficient. And back then we sat together with a couple of students, a couple of computer science students, and we thought of ways to optimize it. And we wrote that little software where you could essentially, it was a huge algorithmic tree essentially, and you could write the report by clicking yourself through, and you had distributions on more probable and less probable outcomes. Okay. And I think that's when everything started. I'm like, okay, you can actually build tools quite easily without knowing much about the technology itself. You don't need to know how to code in order to change something and make something more efficient. And so I graduated med school around 3 years ago. And first I was working at the Institute for Epidemiology and Public Health at the University of Zurich. And in Switzerland, if you're a male over 18-year-old and doctor, you need to go to the army. It's a must. You got a mandatory conscription sort of system. And usually the way it works is, you go to a boot camp when you're like 18, then during med school, you have to go in for like a month or two. They teach you about catastrophe medicine. That's actually it's really cool because they do like real life exercises with like helicopters and police and everything. And you feel like you're on a battlefield, and you get to apply or all of your PHTLS and ACLS and whatever you learn, all that stuff.
Immersive reality,
it's really a lot of fun. Like they really hook you with that. That's the last bit of fun you actually have there.
All right.
And usually then you have to take over a clinic somewhere for new recruits that come in. And they sent me down to an idyllic little mountain place called Airolo. And usually the way that works is you go in there and you have your one patient a day whose finger is hurting, or you have somebody who, wants to go back home because he hates being there, and you listen to him crying for half an hour, and you give him a day off and everything's fine. And then you work out, you enjoy the sunshine, you enjoy the Alps. It's kind of like an additional paid holiday, right? However, I happened to be stationed there in January 2020, and Airolo happens to be approximately 50 to 60 kilometers away from Bergamo. You see where I'm going with this.
Oh, wow. All right. Okay. There's like a change in the tune there, like just with one word,
And I'm there and I'm starting to feel uneasy. Like we're week 2, week 3, you see more and more reports coming from China. I'm like, that looks like something might go down, And like, long story short, I was supposed to be there for 3 months. I ended up being there for almost 10 months. So it got massively prolonged. And what you would expect to happen happened. After the carnival in Bergamo, you have approximately 30,000 people crossing the border to Switzerland every single day. And that's a massive public health hazard, right? And we saw this a bit of an opportunity. So we had the first case on February 28th, if I remember correctly. And I thought, okay, that's actually pretty cool, because we had three companies that were completely secluded from the outside world. And what happened was that 2 companies got infected and a third one didn't. And that was because of certain social distancing measures and hygiene measures that we were able to implement in 2 of them, but not in the third one. And, one day the Surgeon General comes down because we had a enormous amount of COVID cases. I was the only doctor for, I think, over 300 quarantined people, over 100 people in isolation. So it got really tough really quick. I asked him, like, hey, Mr. Surgeon General, it would be really cool if we could do research here. Like if we could just swab those guys every day, if we could look at viral loads, if we could look at serology a few times, if we could look at all vital signs. But essentially I would need a yes from you here and now, and you would need to commit funding immediately as well. And he did. And that was actually it's very rare in research that something like that happens, because usually, you write up a little proposal, it goes to the research committee. And after he said yes, the Ethics Committee of Switzerland said yes within less than 24 hours, which is also a record time. And after 3 days, the whole thing was up and running. And that was pretty cool. If you have a research group, then you have limited resources, you have limited amount of people, and you cannot divide yourself. But if you're in the army, you just snatch 20 soldiers, you give them, you quickly teach them what to do. And suddenly you have a research team of 40 people. And that's exactly what happened. Suddenly, from a small military clinic in the mountains with usually 3 to 4 people, we had more or less 50, which was really
that escalated quickly.
And as I mentioned, what we were doing is swabbing people. So we wanted to also look at viral loads and at CT values, right? And for that, you need swabs. And swabs back then were running out fast, because before COVID, I mean, you're a doctor too, right? Yeah. Before COVID, how many times did you actually swab someone?
Maybe once.
Yeah, exactly. Me too. I'm like, I remember doing it once. Yeah. And that's why Europe was completely unprepared. And the US hijacked all the shipments from China. So for 2 months, maybe you remember that, like, you were using Q-tips, you were using everything, just not swabs that you needed. And if you actually want to do solid research and compare data, you need to get quantifiable results. And we were seeing that we had more or less enough swabs for another week or so, and that's it. And so I called up a friend from the Federal Institute of Technology in Zurich, and I'm like, Patrice, do you know what nasopharyngeal swabs are? He's like, what? And that was usually the reaction of people when you said that. Like, okay, dude, like we need to conduct research. This is the product we need. This is what it looks like. And I showed him an industrial one and asked him, can we reverse engineer it and 3D print it? And he's like, yeah. And he's like, well, let me take a look. And so essentially he dropped everything he was doing and he popped out around 40 prototypes in one day. And we wrote to a lab that was also very interested in what we're doing. So essentially, I think in the end, within 1 week, we had over 100 prototypes. We clinically tested 10 of them. And then within 2 weeks, we had a ready product, CE certified, sterilized, and on the market, which was also record time again. And actually, that's where GobiX comes in, because our first client was the army, and the army cannot buy a product from a private individual. We had to incorporate. And so suddenly, while conducting research and doing that study, we also had a startup that is dealing with swabs back then. And it was more of a side hustle, because following this research project was, by the way, went viral. Like, we were all over the news back then because of what we found out. Because of that, I got involved in lots of other research projects at the university, but also at university hospital. And it was a bit of a side project. We helped the ETH developing saliva containers, for example, with 3D printing. We were working with the Red Cross during summer on a project for Argentina that back then, especially in slum areas, had issues, and we were trying to solve them sort of with 3D printing, but it was sort of a side gig. And I think it was around October 2020 when I was asked to write a review on traveling during the pandemic. And being an avid travel myself, I mean, I love it. It was something I actually really enjoyed doing. So, we were contacting pretty much every single airline there is. We were comparing the hygiene measures they have, the security measures, the testing regimes that they introduced. And something interesting came to light is that more and more countries since June were requiring something called a COVID certificate, which I found really interesting, because if you've ever worked in travel medicine, you know that you required similar certificates in the past, but for yellow fever, you could not enter certain countries. You had those little booklets and you needed a stamp, and without that stamp, you get vaccinated on the spot in that country usually, or you get sent back essentially, right? So this was not really a new story. And then essentially I went through getting denied boarding myself by not reading up on what exactly is required on a flight to Greece. And, mea culpa, should have read up on it better. And I went through the whole procedure of finding a lab, going there, getting sampled, hoping that they actually make it on time, making sure that the sampling time is within the pre-specified window that a country, and it varies by country and by week sometimes even, is correct. And then stressing at the airport, hoping that email will get on time, not having any contact to the lab, because, you call a hotline and they just ignore you. And I did what I think most people would do in my in my position. I Googled. Actually, question to you: Have you ever thought that it's so obvious that a service must exist that you Googled it and were surprised that it doesn't?
Sometimes it happens, and there were some points during the pandemic where I was like, why isn't it here? So yeah, I mean. In fact, the challenge of information within the pandemic was one of the biggest challenges. And many organizations realized this, and thank God there was some reaction. And in Malta, I happen also to be part of the public health response. So like when each story that you mentioned, I was like, wow, all right, there were I can see some parallels. Of course, you've managed to take it to an extra level. And even now I'm also seeing in fact, I was like, wow, this is quite a long story. But what's even amazing that with your story, it's so it really built up, and it explains each and every part of your experience. But I'd like to go, if you don't mind me. It's true that you put a question back to me, but I'd like to put a question back to you a bit. And I can see that you've even managed to, you found an unmet need. And also you had to experience this yourself, which gives it even, shows how raw this story is, how in touch you were with reality. But let's look a bit as well now to the future, Michel. Like, you've been through so much here, and I'd love to hear a bit more as well, a bit about this story of the certificate. But like now, like, how do you think all of this and all that you've discovered will build the future of digital health and medtech, and how does GobiX and Testasy fit into this picture? Like, how do you see it fitting in the, so I invite you to continue with your story, but now, like, looking into the future, how do you fit into the picture? Like, how do you see your future evolving now?
So I think we are a prime example of, we didn't really invent groundbreaking technologies. But what the pandemic did is it showcased that technologies that have been existing for a long time and that have been completely underused are suddenly being used because people were forced into it. And there is an interesting McKinsey paper on the use of telemedicine, for example, that showcases that right after the start of the pandemic, the use of telemedical tools increased 40-fold. It was a parabolic curve, and then it decreased again, but it stayed at a 34-fold level. And so what this pandemic did, it accelerated. It was a catalyst for the medical revolution in medicine, and something that other countries like, or continents, I should say, like China, that are in a slightly more advantageous position than, say, Africa, we're going through in the last 10 years. They've been going through a digital revolution, and you had an extreme growth and acceleration of technologies is ironically now happening or starting to happen more in Europe. And I think that we are very far away from the market being saturated, as not in terms of developing technologies, but actually using those technologies.
Wow, you know, it's in fact, it even reminds me of Malta, because telemedicine in Malta, how it used to happen before, there used to be someone calling the health center directly, and basically there is an operator, and then they get through to the doctor who will try to fit in this little conversation, which could be something as simple as a hurt finger to something serious, and then transforming all of this into a fully fledged telemedicine center, fully equipped by doctors, human resourced, rostered with different hours. Like, this transformation that happened, and this is like looking only at the government provided service. How about the private provided services? How about the growth in chatbots? There was so much going on there, but it had to be, and I fully agree with you, it had to be the pandemic to push this forward. I'm really curious, like now, even, for example, you mentioned the certificate aspects, and now even the EU came out with its own digital COVID certificate, and thank God that now they've reached up to 45 countries. Thank God. Because imagine having to deal with a test certificate or vaccine certificate of every country. But how do you think we can improve that process further from what you've experienced?
I mean, I think that what the EU did is a fantastic first step, but then the problem a little bit was also that you have a bit of a federalistic system within the EU, meaning that you give a lot of responsibility, like you set certain ground rules, but that you give a lot of liberty to the EU countries on how to actually implement those technologies. And some countries do an amazing job at it, and some countries don't. And that's when you start having problems. And I can give you 3 examples here. Let's start with Portugal. That's actually one of my favorite, because as you know, the Web Summit will be happening there. And say you want a COVID certificate. What happens is you go to a lab, you get sampled, and the lab analyzes your sample, and then it's either positive or negative. and then the lab sends the result to the government, and then the government issues a certificate and then sends it back to a client. So you have multiple stakeholders involved, and it's a slow process because it's only semi-automated essentially. So if you're a doctor, you cannot just issue a COVID certificate in Portugal. That's example number one. Example number two is Estonia. You would think that, Estonia, one of the in terms of digital health, most advanced countries, would not make such a mistake, but they made an even funnier mistake, because they did a system that works perfectly for their citizen, because in Estonia was the first country to introduce enabled people to become digital citizen, to create something like a digital citizenship. And essentially that is running on a blockchain ledger, as you mentioned. That was actually created around 2008 after a hack of the government, and they rebuilt the whole system on a blockchain with beautiful solution. And essentially the way it works is every citizen has a certain code, and they can use that to log into their database, and that belongs to them. So the data belongs to the patient, which is an incredible solution. I love it. However, they forgot one thing, that those COVID certificates, a big part of why people use them is to travel. So in Estonia, if you go to a lab and you're Estonian, you can get your travel certificate or your COVID certificate with no issues. But if you're not Estonian, you currently cannot get a COVID certificate, because they did not give you the option of registering with the system if you're not Estonian, which is a bit ironic if you think about it. And so here we have a decentralized network, but with a flaw. And actually, I gotta say, I love the Swiss solution so far the most, because Switzerland did something different. They said, we trust, if we have medical doctors and we have hospitals and clinics, we trust them enough to give them the power to issue certificates. I mean, if you think about it, it's a no-brainer, right? I mean, if you have a medical education, you should be able to do that. And
the
so
same
here,
that you issue a sick certificate, for example, a sick certificate, or there are
exactly,
different kind of certificates that doctors
make
issue.
prescriptions, why shouldn't you be allowed to make a COVID certificate? It makes no sense. So that's exactly how they did it, and the system is super smooth. So I have a patient, I test him, and I can immediately issue a COVID certificate with one button, essentially, without having to, without that waiting time of 4 or 5 hours. And this is one of those examples. Your question was what the EU did and how they could go forward with it. And I think that there's this huge document that the EU started building in, I think, 2011, when it comes to electronic healthcare records and how they would like to digitize them, how they would like to create them. And they were working for 7 or 8 years on it, and things are happening extremely slow on a political level. And by the time they finished that document, you had new technologies like blockchain. They're like, oh shit, we forgot to include that. Yeah, right, that's a game changer. Now let's restart the whole thing. And what I'm missing on an EU-wide scape is less theory about how you would fit some things into a regulatory framework, and more trying to actually roll out those technologies and try to make them work, which is what the pandemic actually forced them to do. Because okay, now we don't have a choice. Now we actually have to go out and do something.
Yeah. So, and even more impressive is that so right, it's true, we're talking about the documentation, but it was achieved in such a short time. Let's say the basic technology, it was achieved, even though it wasn't, the implementation wasn't perfect in each and every country for multiple reasons. But it's possible. So we've definitely learned through the pandemic that implementation backed by high-level political commitment, it's possible,
Absolutely.
But let's talk a bit about MedTech world now. So would it be your first in-person conference since the COVID-19 pandemic started, or you've been to some other conference already?
We've been at one in Poland, actually, from Kazimiński University.
Oh, wow, all right.
Around
Cool.
a month ago. I was a small conference, so only around 100 participants, but it's going to be the first large conference that I'll be at.
Oh, wow. All right. So, Michel, it has been truly a pleasure to speak to you today. It was really insightful, and I love your storytelling. Like there's something even magical, and I hope to hear more of those stories in Malta. And talking about Malta, to all of those who are listening to us, we're looking forward to welcoming you at MedTech World, which is going to happen between the 17th and 20th November. Michel will be there, so you should go and have a chat with him, that's for sure. And with that in mind, I thank you once again, Michel, and hope to see you in Malta soon. Cheers.
Thanks a lot.
Do widzenia.
Do widzenia.